little tour of nursing informatics? So I've been in nursing informatics since the late 70s. This is really kind of an embarrassing thing in my career in some ways because it's been a long, long time. The purpose of this program of this class is not to make you an informatics specialist, but to make you get you aware of nursing informatics and what its value might be to you as an advanced practice nurse. So I want you to keep thinking hard about what you're trying to do as advanced practice nurses and what you're trying to do in the future in your leadership roles. Make sure that this is the only class you're going to have that lets you get in depth with technology, get you down and dirty with the bits and bytes. And so we want to make sure this goes really well for you and is fun and pleasant. So I want you to begin by having an imagination exercise with me. And what I want you to imagine is the dinner plate that knows what's on it. And imagine the dinner plate that knows what's on it is able to weigh food and do a chemical analysis to see what's in the food, and then using an embedded chip, send a query off to a database at the FDA to find out what these nutrients are, and maybe to do a little bit of a test to see if there's any E. coli in here. The dinner plate that knows what's on it can also query your own health record, find out if you're pregnant or allergic to nuts or maybe trying to lose weight, and it will also review what you've had to eat so far today and turn, somebody doesn't want this plate already, but then just imagine that it could turn red if you're not supposed to eat what's on there, like you've already had enough cake and don't have any more, or turn green if it's okay to eat. Now, maybe this isn't exactly the best image in the world of what we want for the future, but if you think about the number of nursing FTEs are tied up every day in intake and output, thinking about how technology might be effective in helping them could be really a successful and important aspect of creating the three-legged stool of improving healthcare, health professionals, patients, and technologies. I want you to imagine some other things. I want you to imagine as an NP, you could easily access every single part of a patient's record created everywhere in the world easily and quickly. Maybe you also can think about the bandaid that could call your cell phone to let you know that an infection's starting. Bandaids now are actually being created with sensors that allow them to detect when the acid balance is increasing, that might indicate different kinds of granularity occurring or cell function going on, so the bandaid knows when the inflammation is beginning to start. Do we want to do this? Are you interested in this? How about an intelligent documentation system that not only captures the spoken indicators of patient care, but also alerts the nurse to the next step in the care process if they need this? Maybe some computer smart enough to put the most current best practices appearing on your screen just as you recorded a patient's vital sign or a set of information. You want to think about technology as a clinical asset, as an extension of the cognitive work that you have to do as a nurse. And so we want to envision a future that is going to have these technologies available to people, and the only way that's going to happen, the only possibility of making that occur, is when we have nurses thinking about a future and the practice demands that they're going to be required to achieve and the technologies that might be able to assist people in doing this. So you're in this course to expand your imagination. We could, I guess, call it a bit like the Imaginarium, huh? But let's talk practically. What does it take to make this happen for a while? Well, the first starting point of nursing, and this is the point where everybody groans, so I want to hear a collective groan. Some way, oh, that was cute. Some way of coming up with common ways of expressing things. Now, common ways of expressing things have been shoved down the throat of nurses for years, and they have not always delivered what was promised. We're not here today to make you memorize Nanda, Nick, and Knock, and we're certainly not here to say CPT codes are right or wrong for the kind of advanced practice work that you all do. You know those things better than I. Where we are right now is to achieve the goals of some of the things we've just seen, whether it's an anticipatory guidance towards best practices or a electronic record that appears fully integrated with information from all over the world. We need to have some common ways to understand and express the phenomenon of nursing. So this is going to be part of our lot for a while. And if it's not, and frankly, very honestly, advanced practice nurses have been left out of the story for a long time. And one of my goals in this class is to excite enough of you to the idea that coming up with a way to ensure that what you are trying to communicate to someone else is heard, acknowledged, paid for, and credited in a way that serves your patients better would be a fantastic goal, and we would go very far in this class. I'd be delighted to see that happen. We'll talk some more next week about issues of naming and claiming, because some of the issues about names and terms can run in the background of a computer system. They don't have to be in the front. You don't have to start off with an awkward phrase like alteration in pain, comma, anticipated. I mean, no one speaks this way. Nobody speaks this way anymore, but we still need technologies that serve nurses, and those technologies require some common ways of talking about phenomenon. We also need robust computer record systems. The computer record systems today, and I've put on this slide a couple of the key systems that are around, are emerging as institution-based, transaction-focused records of things that have happened, and their ability to help us, guide us as professionals or guide patients in the things that may happen or should happen hasn't quite delivered on that yet. So again, bringing advanced practice nurses into the conversation to determine how systems should be configured, not to record what was done, but to record what needs to be done or to guide into a future complex process would be an incredible gift. We also are realizing, though, that a single information system in a single institution isn't enough, that we need to be thinking about information tools that allow for data sharing across lots of different places. In one of the YouTube videos, and I think it might have been Jen, talked about the difficulty even at UW Hospital, where the same information system is in the outpatient area and the inpatient area. It's still not possible to have easy communication between these channels. So there's work that's being done. Wisconsin is a leader in this area. Raise your hand who's was involved with the Wishin project, the person who's working with St. Joseph's Hospital. The Wishin project is a major initiative, federally funded. Wisconsin is a leader in trying to ensure that we can exchange these systems. I also learned from one of you who spoke about childcare, I think this was Vicki, about the challenges of getting foster care records in the city of Milwaukee, especially if a kid has gone into an emergency care situation. The Wisconsin Health Information System is designed to be helpful in these areas, and yet it's not helpful as much as it needs to be to the social service system. Oh, was it you, Kathy? I'm sorry. I'm working on, at least I'm getting the right set of names in, but I'm not matching things yet. I hope you'll forgive me. So you have the ideas already. I want this course to be the springboard to making these ideas transform into making these systems available, because I feel so silly. I feel like that's the $6 million man sometimes saying the technology isn't the problem. The imagination is the problem. And we're going to work on giving you enough confidence in your technological knowledge that you're going to be able to bring forward your imaginations. So my particular area of research is the creative use of patient-facing innovative technologies. The dinner plate, as you see in the lower level, or in the upper right-hand corner, you see a picture of a man using what it was at the time the state-of-the-art device. It was called a web TV. It's a dreadful device, to be quite honest. But we provided this kind of an intervention to people immediately after discharge from cardiac surgery. And we found that people were able to get better faster by using in-home coaching. Now, they don't ultimately get better completely. I mean, everyone does well after cardiac surgery. Most people do well after cardiac surgery. But what does happen in our programs, we learned that people, even with very primitive technologies, get good support in that early post-discharge stage, so that early depression after surgery doesn't hit them quite as hard. And their ability to recover with fewer problems with symptoms was phenomenal. We have a lot of opportunities with patient-focused, patient-facing technologies. But I want to take just a minute to review these 4 areas that I spoke with you about, because you're coming into this at a fantastic time. The world is changing. People are ready for different configurations. So we have the building blocks. We begin with our building blocks: terms and labeling. Now, when you bring patients into the loop, the idea of coming up with a common vocabulary sometimes sounds very appealing to some people. It's not particularly appealing to me, but there has been some work on trying to map the way patients talk about their problems to the way professionals talk about their problems. Regardless of how we do it, when we use a technical intermediary, whether it's a computer system or an iPhone, we've got to find a way to make sure the expression stays common. We also have record systems, but these record systems, notice, are not just hospital information systems, but we need to think about public health record systems and personal health record systems that allow for the seamless integration of health across sites, moving the idea of record systems away from the archival knowledge that people get through clinical information systems in current hospitals to a robust platform that guides direction. There is great work in the last 6 or 8 months that has enabled and invested in the information infrastructure for quality, and we're going to be reading about some of this over the next few weeks. But the projects that are being done, the demonstrations done here in Wisconsin, in the Milwaukee area, with the emergency room data sharing, have shown that people are going to get a more appropriate level of care with appropriate health information exchange. And so the building blocks are all there to make sure that the clinical information systems that we build are truly patient-focused, as opposed to institution management in their scope. I'm not in any way suggesting we can disband the idea of robust business purpose information systems in clinical care, but we have a readiness and the technologies available to create really wonderful tools for patients. So what's the next step that we need? You're not going to be surprised when I put this up here. Nurses with vision. Nurses with visions that can bring the ideas together, that can demonstrate and illustrate these processes. And from my way of thinking, I'm 25 years out of my PhD. I'm not going to tell you how many years out of my bachelor's degree, but Jimmy Carter was president after I finished my bachelor's degree. This is the time for advanced practice nursing to come together with informatics to really accelerate our ability to reach people through technology. So we need your vision. I will help you build the technical skills. I'm not asking you to become computer programmers, but I want you to become comfortable. And I'm laughing at these texts going by. I want you to become comfortable with the technology so we can do some fun things with it. Now, my specialty, my field is called nursing informatics, and it is a recognized clinical specialty by the ANA. The specialization that we have is listed on the bottom half of the screen. Our specialization is manage and communicate data, information, knowledge, and wisdom in nursing practice. And the textbook that I selected for you this semester builds on this idea of wisdom by really focusing on how informatics tools should enhance the cognitive skills of nurses. We'll look at a couple other ones, like telemedicine, that allows the presence of nurses to be in a lot of places. But the nursing informatics specialty draws from nursing science first, computer science, and information sciences. These bring a lot of the mathematical models we use, the kind of tools we build, together to manage and communicate data, information, knowledge, and wisdom to ensure that we have the ability for practice. Yeah, I'm glad you liked the chapter. I thought it was pretty good too. So we're going to switch screens for just a minute here because I want to actually show you a little more complex of a diagram than we see in the text, and that is a diagram that comes out of the work that is focused on the informatics infrastructure for quality. We're going to look at this diagram. It's a little more complicated than the one in the book, and but let me just walk you through this what we mean.